Lately I've been seeing more and more headlines about dengue fever, especially in places like Cambodia. It really makes you stop and think. It feels like it's becoming, well, a bigger issue. What exactly is this disease?
Yeah, it's a really valid thing to be thinking about. Dengue is a significant public health problem, and it seems to be growing globally, actually.
Right.
So understanding it, the details, is pretty important, not just if you live in those high-risk areas, but really for anyone who travels or just wants to stay informed.
Exactly. So that's what this deep dive is all about. We're focusing squarely on dengue. We've gone through, well, quite a bit of material, articles, research, even the guidelines from Cambodia's Ministry of Health.
Good sources.
Yeah, trying to get the full picture. And our mission really is simple and give you a clear understanding of dengue, how it spreads, the symptoms, what you can do about it, the key stuff, without making your head spin.
And hopefully highlight some things that might surprise you, some actionable insights. Because there are definitely some unique challenges with dengue, just based on how the virus itself works.
Okay, let's dive in then. One of the first things that jumped out at me was that dengue isn't just one thing.
Yeah.
There are actually 4 different types: DNV1, DNV2, DNV3, DNV4.
That's absolutely fundamental. Correct. 4 distinct serotypes.
And if you get infected with, say, DNV1.
Then your body develops lifelong immunity, but only to DNV1.
Ah, okay.
It doesn't protect you from the other 3. Think of them like, well, different flavors of the same virus, essentially.
So hold on. That means someone could actually get dengue fever 4 separate times.
Potentially, yes. Over their lifetime.
Wow. That really changes things. It underlines why you can't just relax about prevention, even if you've had it once.
Precisely. And critically, getting infected a second time with a different type can sometimes, unfortunately, lead to more severe illness.
Oh.
Yes. It's not just getting sick again. The second round, potentially with a different serotype, can actually be worse. This whole possibility of multiple infections really shapes how we approach, well, everything. Treatment, prevention, and especially vaccines.
Okay, that's a huge point to get early on. So the virus itself, how does it actually move around? We know mosquitoes are involved, right?
Yeah.
But what's the mechanism?
Right. The main player is the Aedes mosquito, primarily Aedes aegypti. There's another one, Aedes albopictus, that can transmit it too in some places.
Okay.
So the cycle starts when one of these female Aedes mosquitoes bites someone who currently has the dengue virus active in their bloodstream.
Got it. So the mosquito basically drinks infected blood. Then what? Does it transmit it straight away?
No, there's a delay. Inside the mosquito, the virus needs time to multiply and mature. This is called the extrinsic incubation period.
How long does that take?
Usually about 8 to 12 days. During that time, the mosquito has the virus, but it can't pass it on yet.
Ah, interesting. So there's this waiting period inside the mosquito. Does that give us any kind of advantage?
It does, yeah. It offers a window. Only after the virus has sufficiently replicated can the mosquito then transmit it to another person when it bites them. So this period, plus the incubation in humans, which is about 3 to 15 days before symptoms show up,
right?
That whole time frame does give public health folks a chance to intervene, especially with mosquito control efforts. We'll talk more about that.
Okay. And where are the hot spots? Where is dengue most common?
Predominantly tropical and subtropical regions. Think Southeast Asia, the Western Pacific Islands, Latin America, parts of Africa, basically anywhere these Aedes mosquitoes thrive in the warm, humid conditions.
And just to circle back to that earlier point, because it seems so important if you've had dengue once, getting it again with a different type puts you at higher risk for a severe case.
That's a key and sometimes counterintuitive aspect.
Yes.
The immune response from that first infection can, in some cases, paradoxically, help a different dengue virus type infect cells more easily the second time around.
Wow.
It potentially leads to more severe symptoms. It's a phenomenon called antibody-dependent enhancement, or ADE. Researchers are still digging into the exact mechanisms, but it has huge implications, especially for vaccine development.
Okay, ADE, got it. So we know how it spreads. We know a second infection can be worse. What does dengue actually look like? What are the symptoms? Our sources mentioned 3 stages.
That's right. It typically follows a pattern: the febrile stage, then the critical stage, and finally the recovery stage. Each has its own signs.
Let's break that down. Stage 1, febrile. What happens then? This is the first, 2 to 7 days?
Correct. The absolute hallmark is a sudden high fever. We're talking 39, 40 degrees Celsius, like 102, 104 Fahrenheit, and it's often really stubborn, hard to bring down.
Okay. High fever. What else?
Severe headache is very common, often described as pain behind the eyes or across the forehead, and then there's the intense pain in muscles, bones, joints.
Ah, the breakbone fever thing I've heard about.
Exactly. That nickname is no exaggeration. The pain can be truly debilitating.
Oof, sounds awful. Anything else in this first stage?
Yes. Loss of appetite is common. Nausea, sometimes vomiting, maybe some general belly pain. Swollen lymph nodes can happen too. And often towards the end of this stage, a rash might appear.
What kind of rash?
It can vary. Sometimes red spots, sometimes tiny little pinpoint blood spots under the skin. Often shows up on hands, feet, the torso, maybe the armpits.
Okay. High fever, bad pain, maybe a rash. Then comes the critical stage. That sounds ominous.
It is the most dangerous period. It typically starts around 24 to 48 hours after the fever begins to drop. And this is the really tricky part.
My tricky.
Because the fever goes down maybe towards 38 Celsius or 100 Fahrenheit, and people might think, oh, great, I'm getting better.
But they're not.
But internally, the condition can actually be worsening significantly. It's a deceptive phase.
So what are the warning signs then during this critical phase, even if the fever's lower?
Okay, key things to watch for. Really severe abdominal pain, especially on the right side, sort of under the ribs. Persistent vomiting is a big red flag.
Anything else?
Feeling cold, clammy hands and feet. A weak, rapid pulse. Noticeably low blood pressure. These are signs the circulatory system might be struggling.
Okay, those sound serious. What about bleeding? I remember reading about that.
Absolutely. Any signs of easy bleeding are a major concern. That could be nosebleeds, bleeding from the gums, bruising easily, or even bleeding from where they had an injection.
Wow.
In more severe cases, you might see vomiting blood or passing black, tarry stools, which indicates internal bleeding. Difficulty breathing is another critical sign. General weakness, restlessness, confusion, even seizures or loss of consciousness in the worst cases.
That sounds terrifying.
This stage is where the risk of dengue shock syndrome is highest, which can be fatal. That's why getting immediate medical help if any of these danger signs appear is absolutely non-negotiable.
Right. That message needs to be crystal clear. Lower fever does not automatically mean recovery. So after this critical window, hopefully, comes the recovery stage.
Yes, usually starting 24 to 48 hours after the critical phase ends, things start to improve. The severe symptoms lessen.
What did that look like?
Blood pressure, pulse rates start to normalize. Appetite usually comes back. There might still be a rash, sometimes quite itchy, but that fades over time as the body gets stronger.
Okay, so the big takeaway on symptoms, that 24, 48-hour period after the fever breaks is crucial. Don't let your guard down. Watch for those danger signs.
Precisely. Early recognition and getting to a hospital quickly can make all the difference.
Okay, so let's talk treatment. If someone gets dengue, what can actually be done?
Well, the first thing to understand, and this is critical, is that there's no specific antiviral drug that cures dengue. You can't just take a pill to kill the virus.
Right. So what do doctors do?
Treatment is all about managing the symptoms and providing supportive care. Basically, helping the body get through it while its own immune system fights the virus off.
Okay, supportive care. What does that involve?
Timely medical attention is key, especially if those severe, critical stage symptoms pop up. For managing the fever, cooling measures help sponging with lukewarm water on the forehead, neck, armpits, groin.
And medication. What about for the fever and that awful pain?
Okay, this is really, really important. Only paracetamol, that's acetaminophen, should be used for fever and pain.
Only paracetamol. Why?
Because other common pain relievers, like aspirin or ibuprofen, they can actually increase the risk of bleeding, which, as we just discussed, is already a major potential complication of dengue. They can also potentially harm the liver, so strictly forbidden. And even with paracetamol, you have to be careful not to take too much, follow the dosage guidelines, because excessive amounts can also damage the liver.
Got it. Paracetamol only and carefully. What else is vital for managing dengue?
Hydration, absolutely essential. The fever, the potential vomiting, it can lead to dehydration really quickly. So patients need to drink plenty of fluids.
Like what? Just water?
Water is good. Oral rehydration solutions are even better if there's vomiting or significant fluid loss to replace electrolytes. Sipping mineral water frequently is often recommended. The goal is just constant fluid intake.
And when is it time to absolutely get to a hospital, no questions asked?
Okay, immediate hospital care is needed if you see severe vomiting that doesn't stop, intense abdominal pain, especially that upper right side, cold or clammy hands and feet, any bleeding from the nose or gums, difficulty breathing, or any change in mental state like confusion or loss of consciousness, especially if these occur within about 48 hours of the fever starting.
Right.
Trying to manage these severe symptoms at home or delaying getting proper medical care is incredibly dangerous.
Yeah, that seems clear. Now, something you mentioned earlier, vaccines, I saw that in the sources too. People might think, oh, there's a vaccine. Maybe that's a treatment. We should probably clear that up.
Yes, that's a really important distinction. Dengue vaccines are for prevention, not treatment.
Okay.
They're designed to stop you from getting sick, or at least from getting severely sick if you're exposed to the virus later.
Right.
They stimulate your immune system before you get infected. They absolutely do not work if you already have an active dengue infection.
Right. Prevention, not cure. Got it. So since treatment is mainly supportive, prevention becomes even more critical, doesn't it?
Absolutely. The best defense against dengue is stopping it before it starts.
And how do we do that?
It's a two-part strategy, really. First, get rid of mosquitoes and the places they breed. Second, protect yourself from getting bitten. And it needs effort from everyone, individuals, families, whole communities.
Okay, let's start with the breeding sites. What can people actually do around their homes?
Lots of practical things. Cover any water storage containers, tightly water jars, tanks, buckets, even pots. Aedes mosquitoes love laying eggs in clean standing water.
So lids are key. What else?
Regularly empty and scrub things that hold water, at least once a week. Think flower vases, the saucers under plant pots, pet water bowls, bird baths, clogged drains. Cleaning removes the eggs and larvae that stick to the sides.
Right, get rid of the eggs. What about bigger water containers you can't easily empty, like rain barrels?
For those, introducing small fish, like guppies, can work wonders. They eat the mosquito larvae. It's a great natural control method.
Okay, fish patrol. Nice. What else?
Just look around your yard, your balcony. Get rid of any junk that collects water. Old tires are notorious. Empty cans, plastic bottles, coconut shells, any trash. Tidy up. Also, keep drains clear so water doesn't pool. And trimming dense bushes or vegetation helps too. Adult mosquitoes like to rest in those shady spots.
Okay, makes sense. Eliminate standing water. Keep things clean and tidy. Now, what about protecting ourselves directly from bites?
Equally important. Wear long sleeves and long pants if you can, especially during the day.
During the day? I thought mosquitoes were worse at night.
These mosquitoes, the Aedes type that carry dengue, are primarily daytime biters, especially active around dawn and dusk.
Ah, okay, good to know. So, long clothing.
Yes. And sleep under mosquito nets, even for daytime naps, especially if you're in an area with lots of mosquitoes or if someone in the house is sick with dengue.
Why if someone's sick?
To prevent other mosquitoes from biting the sick person and then spreading the virus to others, break the cycle.
Got it. What about repellents?
Definitely use effective mosquito repellents on exposed skin and even on clothing. Sprays, lotions, coils, patches, whatever works for you. Keep windows and doors screened if possible, or use air conditioning. Aedes prefer darker areas, so keeping homes well lit can also help a bit.
I saw this slogan in the Cambodian materials. My family and I are a model family because my house has no mosquito larvae. That really drives home the community aspect, doesn't it?
It absolutely does, because your efforts protect your neighbors and theirs protect you. Mosquitoes fly, right? They don't care where your property line is, so it really takes everyone working together.
Okay, so we've covered prevention basics. Now, let's circle back to vaccines. You mentioned there are different types and the advice varies.
Yes, that's right. Currently, there are broadly two main types of dengue vaccines available in different parts of the world. And who should get which one depends mainly on whether they've had dengue before.
Okay. Why the difference?
It relates back to that complex immune response we talked about, the antibody-dependent enhancement, or ADE risk. The vaccines are designed differently to try and navigate that.
Right. So the sources had a table. Let's look at type 1. This one's for people who have had dengue before.
Correct. Generally recommended for people aged roughly 6 to 45 years old who have proof, usually from a lab test, that they've been infected with dengue previously.
And they might need a blood test beforehand if they're not sure.
Yes, often recommended to confirm that past infection status for safety and effectiveness reasons with this tote.
And the schedule for this one?
It's typically a 3-dose series, one shot, then another 6 months later, and a third 6 months after that.
Okay. Side effects?
Usually mild, things like soreness at the injection site, maybe a headache or muscle aches for a day or two, standard vaccine stuff. Once you've had all 3 doses, you don't currently need boosters, and they generally recommend waiting at least 6 months after you've recovered from dengue before starting this vaccine series.
Got it. Now, vaccine type 2. This one's for people who have not had dengue before, or it doesn't matter?
Exactly. This type is generally for people aged about 4 to 60 years old, and it can be given regardless of whether you've had dengue in the past or not.
So no pre-vaccination blood test needed for this one.
Correct. Not usually required.
And the schedule.
This one is a 2-dose series with the doses given 3 months apart.
Side effects similar.
Yes, generally similar mild effects. Sore arm, headache, muscle pain, usually short-lived. And again, no boosters currently recommended after the 2 doses.
So the key difference seems to hinge on that prior infection status for type 1, and that's because of the ADE concern.
That's the main driver, yes. The worry is that for someone who's never had dengue, certain types of vaccines might, if they later get naturally infected, potentially prime their immune system in a way that could lead to a more severe reaction. It's complex.
Yeah, it definitely highlights why you need clear guidance from doctors and public health officials on which vaccine, if any, is right for you.
Absolutely. Accurate diagnosis of past infections becomes really important for guiding those decisions.
Speaking of guidance, let's touch on those specific points from the Cambodian Ministry of Health. They seem very focused on reinforcing prevention.
Yes, they're really pushing public vigilance. That slogan, "My family and I are a model family because my house has no mosquito larvae," is central to their campaign. It's all about community action.
What are their main action points?
Pretty much reinforcing what we've discussed. Ensuring proper drainage, reporting blockages, actively getting rid of larvae in water containers, cleaning weekly, changing water, or covering them tightly. They also encourage working with local health teams to use larvicides or those guppy fish where appropriate. Specific instructions for construction sites too, keeping them clean, getting rid of water collecting debris, storing materials properly, and general hygiene. Yep. Good hygiene, clean homes, proper waste disposal, clearing vegetation, all aimed at reducing places for mosquitoes to breed or rest.
And they mentioned avoiding bites too.
Yes, reminding people aids like darker places, so keep homes lit, use nets, especially during the day, suggesting long clothes for kids, basic but crucial bite prevention measures.
And their advice on seeking treatment.
Very clear on this. If you get a sudden high fever, get to a public health facility, a health center or hospital immediately, ideally within 48 hours.
Why public facilities specifically?
They stress the potential dangers of delaying treatment or going to private clinics that might lack specific dengue management expertise. And they strongly advise against self-treating fever because you might use the wrong medicine or miss warning signs. Early expert medical care is paramount.
It really paints a picture of dengue as something needing constant awareness, doesn't it? Understanding how it spreads, the stages, those danger signs.
Yeah.
It's all vital for getting help quickly.
Absolutely. And while treatment is supportive, the real power lies in prevention. Cleaning up breeding sites, avoiding bites, that's where individuals and communities can make the biggest difference.
Vaccines add another layer, but require that careful consideration we talked about.
Right. It all points to the need for ongoing public education, strong healthcare systems ready to respond, especially those public hospitals, and continued research.
Definitely. Tackling dengue is clearly a marathon, not a sprint.
It is. Requires sustained effort on all fronts.
So as we wrap up this deep dive on dengue, here's something to chew on. We know the Aedes mosquito is incredibly adaptable. And we know climate change is happening, potentially pushing these mosquitoes into new areas. So, thinking ahead, what other actions, maybe things we haven't even thought of yet, might we need to take, both as individuals and as communities? How do we prepare for future dengue outbreaks, not just where it's common now, but in potentially new regions too?
That's a really critical question for the future. How do we stay ahead of the curve?
Definitely something to think about.